Good morning and welcome to Cornerstone First Aid Chats. My name is Dr. Grandison, and this morning we have the pleasure of speaking with Dr. Joanne Michelle Martin.
Good morning.
Good morning. And Joanne is a physiotherapist that is based in Georgia, United States. And Joanne, tell us something about yourself.
Good morning, everybody. Thank you so much for having me here. My name is Dr. Joanne Michelle Martin. I am otherwise known as Dr. J by all my clients. And I'm a physiotherapist in the US, specifically in the Atlanta metro area. I specialize in working in orthopedic conditions as well as pelvic health. With that, I see a variety of patients for many different conditions in and around those particular niches.
Okay, great. And what exactly is a physiotherapist, and what is a physiotherapist's role in the wider healthcare picture?
That is a great question. I think it's something that's being continuously redefined as healthcare is changing and the healthcare model is changing. Physios are definitely the musculoskeletal experts. We are the people who bridge the gap from the medical and more so the medicinal and pharmaceutical aspects. We are conservative care specialists, and we work with a variety of things, a variety of conditions. We are trained to differentially diagnose conditions. We are trained to treat everyone from pediatrics to geriatrics and everything in between. And so there's a huge role for us to play with, several subspecialties as well and several different focuses in medicine.
Okay, great. So you told me that you specialize in pelvic health. Mm-hmm. Could you tell me a bit more? Exactly what does that entail?
Absolutely. The pelvis is a vital area of the body. It's really the middle of the body. And I tell people all the time, I specialize in everything from the belly button to the knees, everything in and around that area, the muscles, the joints, the ligaments, the neurological system, and so on. More specifically dealing with sexual health, reproduction, and anything to do with bowel and bladder function as well. So a lot of people oftentimes think of those things as more automatic functions of the body, and we don't realize that if there are issues surrounding that usually the pelvic floor and or the surrounding structures have a huge role to play.
You said pelvic floor health. So does that include incontinence, pelvic floor prolapse? Tell me some more about that.
Yes, absolutely. The pelvic floor is a vital group of muscles, much like most people are familiar with the rotator cuff of the shoulder and its stabilizing effects. The pelvic floor runs from the pubic bone in the front to your tailbone in your back. And it comprises of 3 different layers of muscles. And these muscles are supportive in nature. They help with sphincteric function, which would involve the incontinence issues. They help with sexual function. They help with stabilizing the pelvis so that the rest of the body, either the trunk or the legs, can move independently so you're not flopping all over the place.
Okay, great.
So these muscles are very important. And oftentimes, for instance, in the case of prolapse, where there is definitely a weakness of these muscles and therefore the organs tend to descend down onto the vaginal canal or any other surrounding structures, or sometimes in the case of pregnancy, where there's a lot of stretching going on to the pelvic floor, obviously because of the growth of the fetus, you can have a lot of changes there. Most people think that this is specific only to women, but I do see male clients as well for pelvic floor issues, because men have a pelvis too. And so, they also have issues. Most of us hear about things like prostate cancer, prostatitis, even things more specifically related to sexual function, erectile dysfunction, and things of that sort. And also with children who may have a variety of issues, either from a poorly developed pelvic floor or pelvic structures or the organs therein, right. As well as just poor coordination and function.
Oh, great. And I often hear about so many women after they've given birth to the baby, they have so many challenges. Mm-hmm. Is there any role for a physiotherapist postpartum?
Oh, absolutely. And I would say that that's majority of my clientele. We have a saying, once postpartum, always postpartum. I think most people think that help can only be had in the initial stages of the postpartum period or the right. 4th trimester. But what we need to realize is that it's a process. The body has changed. It's taken 9 months for your body to change as you make a baby. And ultimately, it's going to take your body up to a year, right. sometimes even more, depending on the circumstances of your birth, for it to heal adequately and for you to really regain strength and proper function, especially when you consider all the things that are happening, in life with kids, family, work, and other things like that.
What about your patients who are postpartum and have undergone C-section? Is there a role for the physiotherapist? Are there any exercises, any routines that they can go through? Certainly.
Absolutely. One of the first things I actually give all my patients is my ebook. I have an ebook on managing your cesarean scar. It's something that's not talked about. Heaven only knows why, but it's not talked about. And any restrictions from that scar can cause a host of issues. A lot of women have poor sensation. They're hypersensitive. They may continue to have numbness and tingling. They have pain. Their posture can be affected if there's a lot of tightness in the area, if the incision doesn't heal well. If they already have a weak pelvic floor in addition to the cesarean section, then that can make for other issues like the prolapse and so on. Many people often think that because they've had a cesarean that they're exempt from pelvic floor function, or pelvic floor dysfunction, but that's not true. And so, there's a lot of education that goes into working with these clients, and a lot of postpartum care so that they too can heal well and then ultimately function well.
I heard you spoke a bit about erectile dysfunction, which is sort of a taboo topic, and incontinence with women. Incontinence can also happen with men.
Absolutely.
And we tend to shy away from that. Do you recommend, for instance, if a patient comes or has any of these conditions, that they come directly to a physiotherapist? Do they come to a doctor who then refers them out? What is your approach?
Typically with my clients, and in the US we have direct access. I don't need to get a prescription from any of the physicians prior to me seeing my clients. And so usually when I speak directly to patients, either via social media with educational content or otherwise workshops and so on, because I want people to know. Oftentimes they go into the doctor's office and you would think that they'd be comfortable asking the doctor, but a lot of people aren't. And in most cases, most physicians don't even ask questions about sexual function unless they're perhaps a urologist or you're a gynecologist. So these aren't typical questions, and therefore when people are having issues, they don't know where to go. They don't know who to go to. I always tell people, if you're having issues, there's never a bad question that you can ask. You always want to make sure that you're functioning at your best. And if there's anything that is a concern, please get it checked out.
Great. All right. So what I'm going to do is that we're going to tie it up now. So essentially, apart from, let's say, your pelvic floor dysfunction and managing those issues, are there any other issues, very briefly, that you deal with, that you recommend persons to see a physiotherapist for, to have that conversation with them, to take us away?
Yes. So again, I work with a lot of orthopedic cases. You've got back pain, you've got neck pain, you've got any joint pain, any joint issues. If you've had a child, if you're pregnant, you're postpartum, you've had a prolonged labor, especially the second stage of labor. If you've had any sort of instruments used during your delivery, forceps, vacuum, if you had a 3rd or 4th degree tear, which oftentimes the doctors may not say that, what the degree of the tear was. But if you've torn from the vagina all the way down to the anus, that's a problem.
Right.
And it can be potentially a problem because the tearing now goes into the muscle structure of the sphincter, the anal sphincter. If you're having any feelings of heaviness, pressure, you feel like the organs are going to fall out, you're having any loss of urine, any loss of feces, which is again seldom spoken about.
So sneezing and some coming is not normal.
It's definitely not normal, and it should not be your new normal either. These are all things. I mean, there's so many different things, and pain, sexual dysfunction. I talk to a lot of people, and I also speak to a lot of, Georgia is a very conservative state, so I do have a lot of my clients who are very conservative, and I like to tell them, yes, even in a Christian society, within the confines of marriage and so on, you should not be in pain. And I think most people just accept certain things, and you don't need to accept it. If you are having pain, if you are having discomfort, it should not be uncomfortable. It should not be
a conversation not to have.
Yes.
Right.
You definitely want to speak to your spouse about any challenges that you or he may be having, and find a professional who can take care of those things. But there's so many things that we can do, and the beauty of physiotherapy is that we are direct care providers, so we can be that liaison for you between the medical doctors if there needs to be more medical work done.
Good.
We are conservative. There's no drugs, there's no surgery, there's nothing of that sort. And you know, I'm pretty sure most people would rather to be able to solve their issues without any external intervention versus having to go through intervention and then still needing more help on the back end. So
well, thank you so much for being here this morning.
Thank you so
much.
much.
Is there any way that persons can follow you if they wanted some more information or anything like that? You said that you're on social media.
Yes, absolutely.
So
I'm on Facebook at JMM Health Solutions. I'm also on Instagram at The Pelvic Perspective. I can be reached online at my website, www.jmmhealthsolutions. And I also do virtual or online consultations for clients as well. So I do see a lot of clients here from Barbados as well. As well as different areas within the US.
Great.
So if you've got any questions, if there's any way that I can help or help you to navigate your own care, please, please, please don't hesitate to reach out.